Regarding pharmacology, this will be divided into two major branches. One is pharmacokinetics and one is pharmacodynamics. To understand the pharmacology, to study about the drugs, the basics are this: pharmacokinetics and pharmacodynamics. In future, any drug you are going to study under pharmacology, you will be studying about the pharmacokinetic profile of the drug as well as pharmacodynamic profile of the drug. What is pharmacokinetics? As the name indicates, kinetics means movement of the drug inside the body. You are taking a drug by whatever route, either by oral route or by parenteral route or by inhalation route. What happens to the drug? How the drug moves inside our body? So that is explained in the term pharmacokinetics. So what the body does to the drug? We have taken one drug, what happened to that drug? That is called as pharmacokinetics. The drugs, what we have taken, undergoes certain things. What it undergoes? Absorption. It gets absorbed inside our body, distributed, and metabolism. It undergoes metabolism and gets excreted from our body. So in short, ADME. Pharmacokinetic mainly deals about absorption, distribution, metabolism and excretion of the drugs. For example, paracetamol, the common paracetamol what we are taking, it is absorbed orally. When it is given by oral route itself, it absorbs nicely. And it reaches its peak blood level in 30 to 60 minutes. And whatever paracetamol amount you are taking, 25% of the paracetamol bound to plasma protein. Only 75% of the drug is available as free drug and produces the action. And this paracetamol is extensively metabolized by liver by conjugations, and the T-off is 2 to 3 years. And the clearance rate, that is, it is excreted by urine, and the clearance rate is 5 mg per kg per minute. So the details of absorption, distribution, metabolism and excretion of a drug, the study about this is called as the term pharmacokinetics. Why should we study pharmacokinetics? What is the purpose of pharmacokinetics? By understanding pharmacokinetics only, we can determine the proper route for the drug. And we can decide the dose about the drug. Latency of onset, that means in which route it produces the onset of action. In 20 minutes it produces action, in 15 minutes it produces action. Like that, the onset of action can be decided. And time of peak action, in what concentration, plasma concentration it produces peak action. And duration of action, how much time the drug produces the action and how frequency we have to administer the drug. The simple example is, we are taking antimicrobial drugs to overcome the infection. In a particular, some of the drugs are prescribed as twice a day, and some as thrice a day, and some as once a day. So according to their duration of action and frequency of administration of the drug it produces. That means in particular peak concentration of plasma, the drug has got antimicrobial effect. It kills the bacteria. So after the drug effect gets weaned off, we will be taking the next dose of the drug. So all these things will be decided mainly because of this pharmacokinetics. So pharmacokinetics plays a very important role in understanding pharmacology. The second one is pharmacodynamics. Dynamics, as the name indicates, it's an action or effects of the drug inside the body. What the drug does to the body. Kinetics is what the body does to the drug. What happens to the drug? We have studied under kinetics. In dynamics, what will happen to the body because of this drug? So what will happen to the body? Mechanism of action. What are the actions produced by the drug? The pharmacological actions. What are the various actions happens in our body? What are the good effects, therapeutic effects occurred in our body? Toxic effects or unwanted effects, as well as interactions. By taking some other drug, combination of drugs, what are the interactions produced? So the study about the action of the drugs inside our body is called as pharmacodynamics. So if we take adrenaline as an example, adrenaline is generally it produces action by interacting with adrenergic receptors. There are two types of receptors, alpha and beta receptors. By combining with the receptors, the adrenaline produces its action. So how it produces the action, the mechanism of action. It combines with the G protein mediated stimulation, increases cyclic AMP in our body. If cyclic AMP is increased, it produces cardiac stimulation, bronchodilation, so vasoconstriction. These are the effects produced by this adrenaline. These are the therapeutic effects. Naturally, this adrenaline side by side, it produces certain unwanted effects. Glycogenolysis, that means increases the glycogen level, that means glucose level in our body. That leads to hyperglycemia. So, about the mechanism of action, pharmacological action, therapeutic effect, toxic effect and interactions. These are the things we will study under pharmacodynamics. So, what is the purpose of pharmacodynamics? Why should we study pharmacodynamics? After understanding pharmacodynamics only, the action and the effect of the drug will be known to us. So, it elucidates complete action effect sequence of the drug and dose effect relationship. So, in which dose, what is the effect produced? So, dose effect relationship as well as drug interactions and modified actions. What are the actions modified by another drug? So, the interactions. After understanding everything only, we can prescribe a proper drug. So, for this purpose, we have to study pharmacodynamics. So, pharmacology has two major branches, pharmacokinetics and pharmacodynamics. In the future PowerPoints, we will study detail about these things.